guys. So I'm back to do another update, and this time I just wanted to talk to you about how I did my gestational diabetes screening. And I didn't do the blood glucose drink. I had mentioned this in my 7th month update, I believe. That early on with my midwife, I had expressed that I did not want to do the glucose drink. I had done it with my daughter. I didn't like the way it made me feel. I didn't like the way it made her feel because she went crazy. And just after doing that, I did some more research and just found that you can get more accurate results if you're actually testing your blood sugar throughout the day rather than this artificial drink. And they're kind of like artificially inducing a blood sugar spike. Not going to go into too much more detail than that. I just felt like I could get more accurate results if I tested my blood sugar throughout the day rather than just doing the drink. So she had no problem with that, and everything that I needed was actually prescribed to me, and we don't have a copay. So it was nice. There wasn't anything that we had to pay extra in order to do it this way. So this is just a method that I want to talk about because it is an alternative to actually doing the blood glucose drink. So what they gave me is, first of all, this little case right here. So they gave me this little case, and inside this black case, let me just unzip it, is everything that I would need in order to take my blood sugar on the go. And so I'll talk about the contents of this in a second. They also prescribed me a big box of alcohol pads just to clean off my finger before I actually took my blood sugar. These are the little teeny tiny needles that I put into the little device in order to prick my finger and get the blood out. And then this right here, just a little package that is the actual thing that I'm putting my blood into, that I put into the device. Forgive me, I don't know the names of this stuff, in order for it to read my blood sugar. So before I get into the whole process of that, because I'll actually show you how it was done because it was super easy. But what I had to do was, for the course of 2 weeks, I had to take my blood sugar 2 hours after breakfast, lunch, and dinner. So 3 times a day, and snacks and whatnot I was able to eat without having to worry about taking my blood sugar. In those 2 weeks, I had to write down everything I was eating, the time that I was eating it, and the time that I took my blood sugar and what it was, the level that it was. And the reason that you write down what you're eating and the basics of it is because if you do have maybe an occasional drop or an occasional spike in your blood sugar that isn't what is showing up to be normal, they can look back and see if it was related to something that you were eating. It didn't have to be super detailed, like 2 cups of rice with 1 cup of broccoli. It didn't have to be like that. It just had to be like a basic, I had, rice, broccoli, chicken, whatever. Pretty much it was just a way to, if you had like a piece of cake, then they would know, well, that's probably why your blood sugar was so high. So that wasn't that hard to do. I didn't have to be real detailed about it, but I would just especially note down something like if I had, let's see, I really like to make this gluten-free banana bread with my daughter, and it's only sweetened with agave, but agave is like pure fructose, so that can tend to cause a spike in your blood sugar, although it's on the low glycemic index. At any rate, so I would especially make sure to mark down if I had had something that was sweet, or if I had something that I know could possibly spike my blood sugar, like let's just say if I were to have wheat bread or something like that. So I don't have that piece of paper of the stuff written down for me to show you, but basically over the course of the 2 weeks, my blood sugar was great. So keeping that food log was nice because not only was it for their information, but it is also nice for my information to see that if I'd had something that maybe had a lot of sugar in it, and I noticed how I was feeling afterwards, it was really nice to correlate it with my blood sugar and what I had been eating. So it just kind of gave me a more broad view of how the food that I was eating really affects me. And I already know how food affects you, but I guess seeing it in the levels of my blood was just kind of interesting to look at. So anyways, what they were looking for is after 2 hours after you've eaten, they wanted my blood sugar to be 120 or less. if my blood sugar ever got below 70, they wanted me to like drink some juice or eat a piece of candy, something with a lot of something that would rush sugar into my blood, and then wait about 30 minutes, take my blood sugar again, and if it got higher than 170, if it increased, then I was fine. But if it didn't increase or it continued to decrease, then I would need to call labor and delivery and whatnot. So but if my blood sugar, I believe, was 200 or higher, then I needed to call labor and delivery as well. But thankfully my blood sugar never got high. There was a time when I started experiencing like headaches and dizziness, and I just felt really shaky. And so I just thought, why don't I take my blood sugar and see what my levels are? And I did. My blood sugar level is a 68. So it was below that 70 that they were cautioning about. So I did go ahead and have some 100% juice. Took my blood sugar after the 30 minutes, and it had gone back up. I think it was at like a 90 or something like that. I can't remember. That's probably wrong. But anyways, I don't have that piece of paper to look at right now, but it had gone back up and it was normal, and so everything was okay. So that was nice to be able to correlate how I was feeling exactly to the fact that my blood sugar was low and that I needed to be eating something or whatnot. That was the only incident that happened. It was just once, and everything was fine with that. But my midwife said that my blood sugar levels were excellent, and that I'm not at risk for gestational diabetes. And so it worked really well that I was able to still do the gestational diabetes screening, but I didn't have to do that high glucose drink and feel awful and whatnot. I think that the readings that I got were more accurate than whatever they would get by doing the drink. So I'm going to go ahead and show you guys how I actually would take my blood sugar. There will be just a little bit of blood that you will see in this next portion of the video. So I guess if that makes you uncomfortable, then you could stop watching or fast forward or whatever, but it's just going to be a teeny tiny drop of blood. Okay, so as I said, this is a little kit that they gave me, and I would carry this around in my purse. In it, it has, let's see, it has a pocket over here. This part lifts up, and in this pocket right here is where there's a little baggie in there that I would keep the needles in, which the needles, if you can see, this little part right here just kind of twists off, and that is what exposes the needles. So the needles are completely trapped off. You can't like just stab yourself. So that's what the little pocket in there would be used for. And then this pocket flaps over it, and underneath the Velcro in this pocket I would keep the alcohol wipes and the little sticks that would actually that I would put my blood into. On this side is the actual monitor, the device that actually tests my blood sugar level, and this right here is the device that I put the needle into to prick my finger. Could you take the needle and just stab your finger? Sure. But I did it how they told me to, so I'm going to show you guys what I would do. So I would just pull this out of my purse, unzip it, and the first thing that I would do is take out the needle device, and you just take off the cap, and it's empty here, so you can see the hole right there. And I would take out one of the needles, and you just stick it in there and push down. And as you push the needle down, it locks it into the trigger. Then you just twist off the top, and then you can see, there, you can see the needle, just a teeny tiny little needle. So then you just put the cap back on. This has a little dial on it. Let's see. So the little dial there is set to 3, which is the intensity of how hard the needle comes at you, so how hard it pricks you. They had told me that 3 is generally hard enough to draw enough blood, but not actually really hurt you. So I didn't really change it ever. I was able to get a good enough blood draw, and it didn't really hurt, so I just kept it at a 3. So once that was ready, I would set that down, pull out the little device here, and one of the little sticks, which is wrapped up, I would open it, and let's see, on the bottom here where the yellow is where you would, let's see, this is what the little stick looks like. So this part here, it actually goes into the device, and this part here is where your blood will go. And there's a little strip inside there that absorbs the blood. So I would just stick that into the device, and as you can see, it turns itself on and says that it's waiting for blood. So I would set that down, get my alcohol swab. I would also get, I carried around just a little package of Kleenex. Get a Kleenex out and ready. I would swab whatever finger I was going to prick. And they say that the side of your finger tends to be less sensitive than like the actual center. I would do it kind of in between the side and the center of my finger because I found that that's where I got the best draw. So I would line it up on my finger like this. This button right here is the trigger. So I would just line it up, press my finger in just slightly, and push the button. And that caused the needle to poke into my finger, and as you can see, just a little bit of blood. So that first drop of blood I would wipe off onto my tissue because it has the alcohol on it, and then just kind of press my finger to draw more blood out, just a little bit, you can see. And then line it up. Let's see if we can get a good focus on this. Line it up with the white strip that's there and let the blood kind of go into it, and you hear that beep saying it got the blood. So then it counts down 5, 4, 3, 2, 1, and then it comes up with your number. And the number, there it is. The number it's giving me is 84. So it's been about 2 hours since I ate, meaning that my blood sugar 2 hours after I ate was at a level of 84, and they want it to be less than 120. So 84 is great. And between 80 and 90 were levels that were pretty consistent for me. And my levels were pretty consistent throughout the day. So once that's done, I just remove the strip from the device and put it away. Then what I would do is put my alcohol swab back in the little package, put the needle, put the strip that has the blood in it in there as well, and then take the cap off of my needle device carefully, pull out the needle, there it is, and stick that in the same package as well. And then put my device away, just zip it up, throw it back into my purse. If I was on the go, then I would wrap this up with my little tissue, and I would stick this, there's a little pocket in the back here that I would just stick it into until I got home. Because when I got home, they gave me a biohazard bucket to drop my needles and blood into and whatnot. So when I got home, I would just remove it and drop it into the bucket. But I would just drop all of this stuff into the little bucket, into the little biohazard container that they gave me, and then that way I'm not putting any needles or anything into the trash. That's what I did. And so after 2 hours after breakfast, lunch, and dinner, that's what I would do. And I was able to take it with me on the go, so it wasn't like I was stuck at home for 2 hours waiting to take my blood sugar. I would just take a note of when I needed to take my blood sugar, and then while we were out, you know, if it came time, I could just do it super quickly like that. It takes a little bit less time when I'm not having to show the camera exactly what I'm doing. But I would just take my blood sugar really quick, and the device actually remembers your numbers. So if I didn't remember my number, because pregnancy is horrible with memory, But if I didn't remember my number, I could just look back on the device at the last one I took, or maybe 2 times ago, or depending on how long we were out. But it kept a memory of actually the last 7 days. So I would just write the number down and be good to go. So it's super easy, and you can see my finger. You can see there's like no lacerations or anything like that. The bleeding stopped really quickly. So it's super easy. And it's just something that I will do with my subsequent pregnancies from here on out, because I felt like I got better results. Not only was I more aware of how the food that I was eating affected my body, but I also felt like it gave more accurate results for my midwife or the physicians that I'd be seeing to go off of, as far as how my body is reacting to blood sugar and insulin. So that's basically it. I just thought I would show you guys that. It is an option. You just need to ask them about it. And that's it. So I hope you guys enjoyed that, and I hope that it wasn't like too gross if you're really sensitive to blood or something like that. If you guys have any questions about it, I guess you can just leave them in the comment section or send me a personal message. It's really simple and easy, and I hope that that helped kind of explain the process of what I had to do the gestational diabetes screening without taking the blood glucose drink. So I'll see you guys for another update. Bye.